Hello everyone, welcome to Education Talk here at CUNY in the Heights Ostos, Continuing Education and Workforce Development. I'm Seni Tavares, Executive Director, and it is such a pleasure to be here with Dr. Gonzalez. Welcome, Dr. Gonzalez.
Thank you for having me here. Good afternoon. How's everything?
Everything is great, especially because today we have open house and we're going to discuss some of the requirements for your class. Dr. Gonzalez, how long have you been with us?
Oh, 12 years already.
Wow, that's a lot of experience.
Yeah.
Dr. Gonzalez is a medical doctor. Tell me a little bit about what you did in the Dominican Republic as a doctor.
Well, in Dominican Republic, we have a very hard program. And we had to know a lot of things. When you graduate as a medical doctor, you got to go from different things, different hospitals. And it's intense, the practice in there. And then you learn a lot by force, by willing and by force.
But this is the type of instructors that we have here, professionals like yourself that have the hands-on experience. So students watching us that are interested in the clinical medical program will learn firsthand from Dr. Gonzalez, who brings a lot of experience. Dr. Gonzalez is teaching the EKG phlebotomy requirement of the clinical medical assistant certification that we have here.
Right.
It's about 3 months, which is what, 120 hours?
Well, we have different programs. We have the EKG that usually is 32, 34 hours. Then phlebotomy is around 84 hours. And the PCT that takes then phlebotomy, EKG, and CNA. Mm-hmm. So the students are preparing here in a way that when they go to the market, they have enough knowledge and the preparation, the skills to excel, not only to be good, but to excel.
The skills to do the job as a clinical nursing assistant, or clinical medical assistant,
or PCTs, patient care technicians.
Right. Tell me a little bit about that class.
Well, the electrocardiography is the branch of the medicine that studies the electrical impulses of the heart. So we have the proper machines and the proper equipment to teach the students how to manage the instruments, how to connect all the leads, the Holter monitor, the stress test. So it's a very interesting class because they learn about the anatomy and the physiology of the heart, all the electrical impulses, how they are produced, and how to read even all the signals that are recorded in the electrocardiogram. The phlebotomy is another interesting class because these classes are on demand now in the market because they are needed in the hospitals. They are needed in the nursing homes. They are needed in the labs. So
there's a high demand in the technical medical careers, and that's why we're very well known for the courses, and you can see why. We have professionals like Dr. Gonzalez who bring a lot of experience. So you leave here, as Dr. Gonzalez stated, with the skills required to excel, not just to be average.
Exactly.
The other thing is the requirements are really you have to have your GED.
Oh, yes.
And you have to speak English because this class is conducted in English. Mm-hmm. And of course, the desire. You teach 2 classes, one in the morning and one evening, is that right?
Yes.
So the morning it's about from
10 a.m. to 3 a.m. to 1 a.m. to 2 p.m. It depends what is the class. And at night, usually from 6 to 9 p.m.
So for those students that work, they can come from 6 to 9?
Oh, yes, definitely. And usually the first meals are a little review. So the ones that cannot come here exactly at 6 p.m. because they finish at 6 p.m. but they're in the area, they have the chance to come to class anyways.
Tell me a little bit now about the phlebotomy class. I know you talked about EKG.
Exactly.
So now phlebotomy. What do you teach in that class? What is that? So those that are watching us.
Phlebotomy is the EKG. We have the section that is lecture and the other one that is for skills. And we have even the mannequins in here so they can practice all the lecture that they have. They learn anatomy of the cardiovascular system, all the venous system, the veins that are usually the ones that we prefer to draw blood from the people. And as they have the mannequins in here to practice, they have their hands on too, and they learn the techniques how to do it. They need to know the techniques how to handle the samples when they are taken to the lab. So we provide with that. We provide all the information about infection control, how to take care of themselves in the media, of all this type of probable infections that are in the environment, and how to take care of the patients too. So it's important right now in the hospitals to have that satisfaction of the patients, and we strive on that. Not only to teach them in the classroom how to prick a person, how to draw blood from a person, but how to conduct themselves in the environment, in the medical environment.
That is great, because I think some folks take the class, but then they don't have the know-how or the experience to navigate once they get a job, whether it's at a medical office or at a hospital. So Dr. Gonzalez, thank you so much for being with us. I don't know if you want to add anything else to those students that are watching us to motivate them to come and register, because we are registering right now. We have a bilingual personnel in the front, so they only have to call 212-567-7132 or just show up here, 5030 Broadway, ground floor. We have a special entrance that says CUNY in the Heights, or just to get online. We have our website, OSTO's website. Google us and you'll see everything. We're on social media. I don't know if there's anything you want to add.
Well, the only thing that I can say is that if you're going to be my student, you have to be committed. And you're going to expect to be a professional when you're in the classroom, when you go outside to get your job, and when you get it there. And congratulations if you decided. I'll be waiting for you.
Thank you so much, Doctor.